Hi, my name is Janice Daniel. I'm advocating on behalf of American Academy of Pediatrics, dedicated to health of all children. I'm studying more on the impact of poverty on nutrition of children. Recent studies have shown that poverty has a large con- consistent associated with negative outcome in a child nutrition in the United States. Poverty health affects the nutrition of children, and this issue has been a significant and growing social problem. Poverty is a major factor that negatively affects children's nutrition and hence their development. The official poverty in the United States vary according to the factor that the money and income and number of adults and children in a family household. Poverty leads to substantial nutrition and poor motor skills in children. This substantial nutrition is also associated with wasting, which is known as low weight for age, and stunt growth, which is low height for age, in children in the United States. Research shows suggested that a combination of parental efforts and social programs currently designed and implementing can improve the life of poor children and their families. Research also show findings that stated that the need to resume effects to reduce the child poverty rate even as other issues command in the nation. Poverty is associated with obesity among children in the United States. This is because children living in poverty are more likely to have irregular eating habits and will eat whatever comes to them as long as it's food. Poor nutrition also leads to a situation in which poor children are at a higher risk of developing chronic health problems like anemia and asthma as they grow up. Children living in poverty are most likely to become physically impaired, and this would cause a lot of restriction in their future activities. Children living in poverty are more vulnerable to risky health behavior like smoking, getting involved in early sexual activities at a tender age. Health problems that result due to poverty during early childhood can become a risk factor themselves that would develop problems later in life. These include problems in achievement, physical language, and social emotional domains. Reduce of health and safety standards are a major factors in life of children who experience long-term poverty. For instance, growth difference between poor and non-poor children are much more effective when using a long-term measure of poverty, even when adjustments are made in family characteristics. Poverty leads to a poor health in children and poor health in various negative educational outcomes. Childhood health programs may change education. Recent studies have shown that the impact of malnutrition and poor health on children's education varies with family economic status and might become more pronounced in the case of disadvantaged families. Children suffering from chronic health problems process more slowly through school than children with wealthier families. The results from recent studies suggested that when children are raised in poverty, they are placed at a higher risk of various negative outcomes, which can extend into their adult life. Research has shown that there are numerous impacts by which poverty affects the health of a child. Poverty leads to a situation in which children are exposed to risk factors like environmental, maternal depression, parental substantial abuse, and low quality child care, violent crimes, and divorce abuse. Poverty and inaccurate nutrition are likely to affect children and their psychological readiness for educational development and studies, and the social support they may need for it. In order for effective tackle child poverty in the United States, it is vital to consider wider family circumcision, and the effort must be made to provide legal guardian and parent of the child with, with support to bring up children. This can be in the form of financial support, information, and advice. There are two major aspects of some cases that impact child poverty in the United States. Reduction of joblessness among adults who look after children, promotion of longer-term outcomes through interventions that are designed to effectively deal with the nature of child poverty and malnutrition. The aim of child nutrition in legislation and strategies is to provision of opportunities for children and young people to succeed in life, and to address the cause and effect of disadvantage as a result of poverty and the inadequate nutrition. It is important for the state and I to advocate for the proper level of income resources on behalf of the children and their families. Families should also be given support in accessing their benefits. It is essential that children are put at the center of child poverty. Legislation strategies that the views and perspectives of these children are taken into account when developing poverty programming and policies. Effort must be maximized in strengthening and improving prevention and early intervention for these children and their families, especially during their first 3 years of life, so as to improve their future outcome in health and well-being. Families who are experiencing food poverty and lack of accurate nutrition should also be helped so that they can be able to accurate the food and nutrition necessary for them to stay in good health. As an advocate for American Academy for Pediatrics dedicating to the health of all children, I am pleading to the legislation to vote for this policy. There is a great need to consider the policy that affects the nutrition and well-being of the children in the United States, as they are the youngest and most vulnerable members of our society. Although the current strategies and legislation on child nutrition and health have been structured to be as political as possible in order to determine which program and effectiveness works, children are still vulnerable to the negative effects of poverty and malnutrition that results from poverty. I would like to thank you, and I hope that you consider this policy and you vote for the children that need it.